Treatment, lots of barriers. This is true with offenders as well as staff. They learn the words but not the music. You know, they can kind of regurgitate it back to you, but they really don't get it. They do just enough to kind of pass. Again, take the parts they like, that are easy, and they don't take the parts that, you know, are challenging. For example, with ethics, I can tell you, officers are actually pretty good. They're good at developing relationships. That skill is, we see high scores in there. They're pretty good at even appropriate use of authority. They're actually pretty good at that. I tell you where they fall down. They don't like to role play. They don't like to role play. They're not comfortable doing it. Right? And that's a challenge. Right? But if you're going to practice, you got to figure out how to do it. Right? So we know there's some things that they're not comfortable with. Sometimes in treatment programs, they don't like changes to the schedule, especially if it's going to increase the dosage. I understand that, more work, but we have to figure out how to do it. Quick to conclude that changes of treatment aren't working if someone fails. Okay? Remember what I said, you're dealing with high-risk people, you're still going to have a lot of failures. Lack of consistency. In terms of quality assurance, there's always drift from the model. Introduction of new program components that are not consistent. This drives me crazy. You put a program, you spend a lot of money, you get people trained, and then you go to some conference and somebody's doing, equine therapy or drum beating, and the next thing you know, you're bringing it back and you're introducing it, and pretty soon you lose your model. You have an eclectic model, right? And that's not what the research says. The research says the most effective programs have a model they follow. I'm not saying you can't do activities. I don't want you to leave here saying, well, Latessa said we should never do that. I'm not saying you can do activities, but they're activities. They're not the same as your core correctional programming that's designed to reduce recidivism. Failure to have QA. Everybody we assess, that's where they score the lowest, is quality assurance. Quality assurance, right? Or they don't respond to QA. And QA, you have processes in place to monitor your program. You reassess people to see if they're hitting their target behaviors. Get an evaluator to work with you. All right? You don't have one, go to a local university or college. See if somebody there will come in and help you evaluate yourself. Track outcomes. Right? You don't need to track everything. Just come up with 3 or 4 important outcomes and track them. Right? And you got the basic structure to a good quality assurance program. Right? Somebody sits in on groups once in a while, you get reports, you give feedback, and you have some measures that you look at. And then there are other barriers, outside influences, obviously politics, financial, personal, those kind of things always get in the way. And failure to develop internal capacity. Let me just say a word about that. I think it's important, and it's great that you're all kind of together on this, you're working as a community. Anything you get involved with, for example, trainings. You buy a curriculum, or you go get a curriculum, or you get an assessment tool, you always ought to be asking, do you train people, and do you have a training of trainers component? Right? Because let me tell you what happens. You spend a lot of money, you come in, you get people trained, and then 2 years from now, you got a bunch of new staff, you're not going to spend that money again, guess how you're trained? Watch me, and you'll kind of figure it out. Okay? And that's when models start to break, they start to drift, right? So in a community this size, whether it's substance abuse or assessment or thinking for a change, any curriculums you use, make sure that the folks will agree to do some training of trainers. Because you need to have an internal capacity to keep sustaining. All right? So, for example, we're going to train California Corrections and Rehabilitation is adopting a substance abuse curriculum that we developed, and we give it to them. They're going to train people. They have thousands of people that need to be trained. I'm not coming to California to train thousands of people. Even my staff, we can't do that. So we'll have a model where we'll train like 25, 30 people. We'll pick the best people from that group. They'll go through a training of trainers, and in California we'll have the capacity to keep training people over time. so you can sustain them all. But these are things you don't think of when somebody comes in and sells you the latest, greatest, whatever you're going to buy. But you have to think about that because you're not going anywhere, and offenders aren't going anywhere, and you need to keep doing this stuff. The other thing I would say about the ethics model, I just want to point out, if you're astute, you saw some elements of motivational interviewing, right? But here's where this differs. And again, I want to say the limitations of motivational interviewing. I'm motivated to do a lot of things I don't know how to do. I like to do brain surgery. Anybody let me practice? Why not? Pretty steady hand. You know, my eyes aren't that good, but of course you would. The fact that I'm motivated doesn't mean I know how to do it. And I think the same true with offenders. And when we thought about ethics, we thought, what's the limitations of motivation? Well, we get them all motivated and we got nothing for them. And so Mindy didn't stop, right? She didn't stop by saying, well, what do you think? Right? You think you'd like to do that? She did it. We showed them how. And so motivation's a big barrier. I'm not denying it. But just because you're motivated doesn't mean you have the skill. And so you really have to put them together. If not, you got a bunch of motivated offenders, and they're not getting what they need. It's an anxious ones. I actually like anxious ones. All right, that's not a problem. I tell you a quick story. A friend of mine is a psychologist, and she had a bank robber once. She works in the parole office, and this whole idea that anxiety is related to criminal conduct, and it's not. But she asked the guy, she said, when you first robbed the bank, what did it feel like? He said, I was so nervous I could hardly go in the bank. And she said, what did you do? He said, I took the Valium. After that, it was easy. So that's not a big target, all right? Anxiety is a big target.